It's hard to believe that, but more than 7 million Americans are walking around with man-made knees and hips. And Dr. William Kurtz is here from St. Thomas, an orthopedic surgeon, to talk about really this growth in younger people having these man-made parts.
Right. So
why is that? Just right out of the gate, why are we seeing so many young people?
Well, a lot of us have been playing sports all our lives,
Yeah.
and so we've had old ACL injuries and had a couple surgeries along the way. And so ultimately, when a lot of people are getting in their 50s and 60s, their knees are more like the knees used to be when they were 70 or 80. So we're seeing a lot more arthritis at a younger age, mostly due to traumatic injuries in their sporting careers earlier in their life.
So usually an injury triggers it more than just overuse.
Correct. Usually a lot of these younger patients are post-traumatic. They've had sporting injuries at some point in their life, and it just kind of catches up with them maybe 20 or 30 years later.
Mm-hmm. What about the incidence of obesity with you know, that's really hard on your joints, in particular your knees, right?
That is correct. The obesity is definitely takes a bigger toll on your knees than any other body part. And so patients, unfortunately, a lot of our community is a little bit more obese than we used to be, and that has driven the knee arthritis rates up and the knee replacement rates up as well.
Is there anything else contributing to this? Is there any other activity that we are doing or not doing? Are we not stretching enough? Is it a lot of running? What in particular?
Well, actually, you know, I think it's a misnomer, but exercise is actually protective to your knee joints. So gentle, everyday exercise actually helps keep your cartilage healthier. And so I think a lot of us have stopped exercising, at least not as much as we used to. And so that actually, when you stop exercising, that can contribute to developing knee arthritis over the years. So if you're out there, try to keep exercising as much as you can.
Mm-hmm. What do you think about yoga? Do you like yoga and Pilates?
I love yoga. I don't personally do yoga. I wish I did, but it is a wonderful form of exercise to work on balance and strength in a very low impact way. I always recommend yoga if you have the opportunity.
So by the time someone gets to you, obviously for the surgery, they've been through a number of diagnostic kind of tests. Walk me through what a patient would go through.
Sure. So we offer usually about 5 or 6 different non-operative treatments, and I always encourage patients to utilize that as much as possible. So we never in a big rush to do surgery on patients. We try to postpone that as long as possible. But most patients will try some anti-inflammatories. There's about 3 or 4 different types of shots we can give them into their knee joints. They'll try some exercise programs, maybe some weight loss programs, and some bracing sometimes. And we try to maximize that and do that as long as possible. When all that stuff no longer works and the person's quality of life is really suffering, that's when we start talking about doing a joint replacement.
Could physical therapy also be a kind of a stopgap measure?
Sure. A lot of us have muscles that aren't quite as toned as they used to be, and so a lot of times therapy a therapist can help stabilize patellas and strengthen the joints so that they can hopefully postpone a knee replacement for a while.
But you do a lot more knees than hips, correct? Or nationally?
Nationally, that's the case. I personally am about 50-50.
About 50-50, okay. So if you have a knee replacement, is that good for life? Let's say let's throw out an age. Let's say you're 50 and you have a knee replacement. Is that good for life? I know it depends on. It depends.
Usually knee replacements are going to last 20 to 30 years.
Okay.
The materials are a lot better than they used to be. So, you know, if you were talking about 20, 30 years ago, then those knees would last maybe 10 or 15 years. But we've gotten the material science down pretty good. Usually you can count on 20 to 30 years as long as you don't fall down. That's probably the #1 complication I see is people falling and breaking things. And you can still break bones with a joint replacement. So just got to be careful. You got to be kind of common sense approach to how you treat your joint replacements.
Can a lot of people do what they did prior to and even more? Obviously, if they're in a lot of pain leading up to that, they're probably going to be able to do more than they did before. But can you still go back to running?
Sure. With a hip replacement, you can do anything you want to do. I've had some of my partners swim 3 miles in the ocean, jog marathons. All that stuff is easily doable with a hip replacement. With a knee replacement, most patients are walking instead of jogging, but some do jog, but that's on the rare side. With a knee replacement, most of them you're gonna lose a little bit of your proprioception. You lose your ACL, so you're not doing cutting and pivoting activities with a knee replacement, but you can exercise, you can golf, tennis, hike, snow ski, that sort of stuff.
If it wears out, how do you know? Is it pain, or what happens to indicate that it's not working anymore?
Sure. Well, some patients do catch it early and they have mild symptoms, and we can go in there and do some small surgeries to give them another 20 years on that knee. just by replacing the plastic. But more often than not, patients don't really come into the doctor when they should, and we end up seeing more wear and tear on the bones, and that sometimes requires a bigger surgery.
Okay. Now, are there benefits to having the surgery at a younger age? Is it better to try to wait and put it off as long as possible, or to get in there earlier?
I generally counsel patients to wait if they can. It's easier to recover if you are younger. That is a plus side, but you know, these implants are 20, 30 years, and if you're 40 or 50, if you can postpone that surgery, I think it's in your best interest. But you know, if you're miserable, if your quality of life is suffering, then just go ahead and get it fixed, because you want to have a productive life. You don't want to be in misery all the time.
You know, my husband and I, we have a friend who just went through a hip replacement, and I think they had said, listen, you'll recover faster from this than your back surgery.
Yeah, for sure.
That's the case now,
yeah,
right?
Hip replacements, 3 or 4 weeks, they're back to doing most normal things. It's pretty amazing.
That is incredible. How fast do you get someone up and moving after you've done a hip?
An hour or two after their surgery.
An hour or two?
Yeah. These implants are, all surgeons put them in so that they're solid right from the beginning, so you can get up and do normal things. My one and only rule is just tell people not to fall down, and that's the main concern.
What's the material? Did you mention plastic?
Most of the part that bonds to the bone is titanium, for the most part, and then the bearing surfaces are usually polyethylene.
Okay, all right. One last question before we wrap up. Are there any alternative treatments to these replacements?
Sure. There's, like I mentioned, there's about 5 or 6 non-operative treatment things, which are shots, cortisone shots, lubrication shots, platelet shots, or anti-inflammatory medicines. And general exercise. I think keeping your muscles strong is a good way to prevent having these joint replacements.
Okay, and you said, again, just moving around, probably walking, swimming are some of the best.
Swimming is great.
things.
Yoga is great. I like closed chain activities, which is like a stationary bike or a rowing machine, because it's non-impact and really can help strengthen the muscles without wearing them out, the joints.
All right, Dr. Kurtz, thank you, very informative, appreciate it.
Thank you, Amy, I really appreciate this.
All right, take care. And we'll be back with a lot more right after this.